think one of the things that parents don't understand, or when they get a diagnosis, an autism diagnosis, is what's going to happen. So you finally reached out, you've talked to a doctor, you've expressed your concerns, you've got a diagnosis of autism. On the diagnosis, there'll be a section where it gives you some resources of things to look into, and one of those things will be ABA resources or ABA therapy, and you'll probably get a prescription for ABA therapy or a recommendation for ABA therapy. When you do get a BCBA to come in, we do the informal assessments and then the formal assessments, and then we'll bring in that treatment plan for you to sign and agree to. This is what we're going to treat, this is when we're going to treat it, this is how we're going to treat it. And so once you get to that point, they will try and find an ABA provider. And what I mean by that is a registered behavior technician. So your BCBA doesn't come in for all of the sessions. They oversee and supervise the program. They are the brains behind it. And then we bring in a registered behavior technician who has been trained in behavior analysis and stuff, not in the decision-making part, but in the actual running of programs. So in those formal assessments where we found those missing skills, then a registered behavior technician will come in and run trials and repeated practice for each of the skills that's needed. And there's lots of different ways to do that, but typically research shows that ABA is best in the home and 2 to 3 hours a day and 3 to 5 days a week. So anywhere in there, you're looking at 10 to 15 hours a week of therapy. Typically these providers are college students who are working on the side. They need something flexible. So you typically get college students, and we love our college students. There's some problems with that. You know, they change their schedule, they come and they go, they graduate, so it can be hard. So I want you to really be aware that you may find a really great RBT and they'll do fabulous with your child. And unfortunately, because of the scenario, the standard, what's going on in their life right now, you know, they may not always be your therapist. So another thing I'd like to really encourage parents to do is be on top of that. If it's not a good fit, if the RBT that comes into your home isn't meshing with your child for whatever reason, I encourage you to keep looking, you know, just be very verbal with your providers that you want someone that's a really good fit. If you're going to have someone in your home for 10 to 15, 20 hours a week, they should be really, really good friends and a really good fit, and don't be afraid to ask for that. So this RBT will come in, work 2 to 3 hours a day with your family, and then your behavior analyst should be in at least 10% of the hours, so twice a month for at least 10% of the hours. I would typically go into a home for 2 to 3 hours twice a month. Then if you aren't seeing your BCBA at least 10% of your hours, it's not okay, and I want you to really reach out because it's important. While you can get really gifted RBTs who are intuitive and kind of get it and kind of know what to do, there's no substitute for the master's degree and education that's required from a BCBA to do that kind of thinking for you. So be sure and reach out about that.